Discover over 100 episodes of Bartholomewtown on Spotify or wherever you get your podcasts.
This is the Bartholomewtown Podcast.
I talked a little bit about the career trajectory that I've had as a result of my recovery, which is, I have to pinch myself almost every single day. I walk into the State House and get to walk up the stairs into that rotunda in that beautiful building and walk into a governor's office. That's a humbling experience.
Welcome in to another edition of the Bartholomewtown Podcast. I'm your host, Bill Bartholomew. On today's episode, I sit down with a senior advisor to Rhode Island Governor Gina Raimondo, Tom Coderre. And a highly compelling and detail-oriented conversation with Tom here at the Loft, largely focused on the opioid crisis here in Rhode Island and combating addiction as a whole. Now, that's the bulk of his work as a senior advisor to Governor Raimondo inside the administration, and frankly ties into his own personal backstory. So stick around, an important conversation with Tom Coderre in a matter of moments. Okay, support for the Bartholomewtown Podcast comes from PDQ Graphics of Newport. Now, they're a full-service commercial printing company and graphic design studio. You remember those Bartholomewtown Live at PVD Fest posters I was taping up all around the state? Well, those were printed by PDQ for us, and they've been printing large and small-scale projects in Rhode Island for decades. In fact, they're going to be celebrating their 40th anniversary next year. Go ahead and check out their website, pdqri.com. All right, beautiful people of Bartholomewtown, we have been on this journey together for about a year and a half now, and hey, appreciate every one of you who have been there since the beginning, and those of you who have hopped on maybe like yesterday, maybe this is the first episode you've ever heard. Sincerely appreciate all of you. Now, there's almost 130 episodes up at ripodcast.com, bartholomewtown.com, and on your preferred pod app, and a great way that you can support the program is to subscribe, rate, and review wherever you're listening right now. Without further ado, my conversation with a senior advisor to Rhode Island Governor Gina Raimondo, Tom Coderre.
I was working down in Washington, D.C. You may or may not know, I had my own personal story of addiction and got into recovery back in 2003. I'm a former state senator from Pawtucket, where I served for 8 years. Went through my own battles of addiction when I was in the legislature. Ended up getting out of the legislature, got into recovery in 2003, and started right away because of the nature of recovery is that you don't do it alone, that you have peers who you work with. I got involved with a bunch of my peers because I had been involved in the legislature before. I had an interest for advocacy and public policy, so I instantly got attracted to an organization called Rhode Island Cares, which is Communities for Addiction Recovery Efforts. I ended up joining that organization. When they found out I was a former legislator, they said, "Oh, good, you'll be chair of the Legislative Advocacy Committee."
Right.
And all of a sudden I was running Legislative Day and started to really, that's how kind of I got back into politics after getting, going out of politics, in a pretty unceremonial way, and then be able to come back and do this work. It's been the great honor of my life. After working with Rhode Cares, I ended up going down to Washington to work for an organization called Faces and Voices of Recovery. I did that 2 years as their national field director. Then I came back to Rhode Island when Chief Teresa Paiva-Weed got elected Senate President, my former colleague. She asked me to be her chief of staff. So I was Teresa's chief of staff for 6 years. That was really an amazing opportunity where I saw my life come full circle. Having served as a member of the Senate, kind of lost everything through my addiction, got into recovery, and then here I am back in the State House again in a prominent position in a chamber where I once served. So that was an amazing opportunity to not only have a sense of redemption for what I had been through, but also to start working on this stuff from state public policy level. I did that for 6 years, and after being there for 6 years, I got asked by the Obama administration to go down to Washington. I was a presidential appointee. I was a senior advisor and then chief of staff at the Substance Abuse and Mental Health Services Administration, SAMHSA, which is one of the 11 operational divisions of the U.S. Department of Health and Human Services. After doing that, that's when the governor got elected. Shortly thereafter, I went down to Washington in 2014 to do that. That was the same year she got elected. She got elected and started getting very involved in the opioid crisis, which had really impacted the state because of the number of people that were seeing lost to overdose. She kept talking to me about coming back home. When are you coming back home? I need your help. I said, I'm here. And I was able to work with Secretary Bean, who at that time was Deputy Chief of Staff in her office. So I stayed close to him, and then to Matt Bucci, and then finally to Brett Smiley. And Brett, after I finished up in the Obama administration in January of 2017, Brett and I started having conversations about really coming back and joining the Raimondo team, becoming a co-chair of the overdose task force, and then leading some of the mental health and addiction work out of the governor's office. That was a big priority for the governor.
Well, that sets up quite an authentic voice in any kind of huddle, I would suppose.
Sure.
When you're, even just the fact that of your, Pawtucket background, representative of the northern Rhode Island portion of the state, and obviously your experience, life experience and career experience. So that's a factor that is often overlooked, I think, in state government.
Yeah,
it's not just about one person. What are the voices that are in those decision-making moments?
You're absolutely right, Bill. And I think one of the things that you can't plan for, or you can't necessarily go out and manufacture, is somebody with a story like that, right? That you either have it or you don't, and it's something that when you have it and you get tapped to be part of a team like this, you can bring that voice. You can bring an authentic voice, not just on mental health and addiction issues, which is really the area I want to focus in, but also, like you said, whether it comes to, what's it like being in the legislature? What's it like growing up in a blue collar family in a mill town? What's it like, to struggle and to get to the other side of it? I think those are all important qualities that you can bring to a governor's office.
Absolutely. What is it like to struggle and get to the other side of it? Just as the human being that you are, before we get into some of the work you're doing. Can you sum that up in words?
It's well, I don't know if I can, but I'll try. I think it's extremely humbling. At first, it's humiliating, right? I went through a process of addiction where, that was out in the public for everybody to see, and it was ugly. Addiction is not a pretty sight. And so to have gone through that process, and then I got arrested in my home city of Pawtucket, for possession of narcotics, ended up on the front page of the newspaper and on all three networks at one time, ended up getting incarcerated for a short time, had to go to residential treatment facility. That was a really humiliating time in my life. But, as you talked about, getting to the other side, that's very humbling. So I think recovery is a process of taking the humiliating and turning it into humbling. And when we have that humility, I think in our lives, we can approach things a lot differently. I feel really blessed that I've had this 16 plus years in recovery. My life has changed dramatically in that 16 years. I talked a little bit about the career trajectory that I've had as a result of my recovery, which is, I have to pinch myself almost every single day. I walk into the State House and get to walk up the stairs into that rotunda in that beautiful building and walk into a governor's office. That's a humbling experience. But I think, in addition to that, one of the things you have to realize is that, you're just like anybody else. You're human. It really humanizes you in a way. So you don't, you drop the ego, the pretense, the layers that sometimes politics layers on you, right? When you're in elective office, you drop all those things and you become truly authentic, I think, in a way that you wouldn't have been able to before.
So when we look at Rhode Island now in terms of policy, particularly the work that you're doing on addiction and recovery.
Sure.
There's always the conversation today about education as a pinpoint. Of course, infrastructure plays in there to a large extent. Environmental issues play into just stabilizing the state and building towards the future. It's economic development, linchpins, I suppose.
Absolutely.
But before a workforce can be created, before you can, have the society we're going for, this is an epidemic that has to be cleaned up, right? This has to be put on that first pile of
it's a public health crisis, quite frankly. And, the overdose, we call it the opioid crisis sometimes, or the overdose epidemic. It really is an epidemic of significant proportion. Last year, we lost 314 Rhode Islanders to drug overdose. Fortunately, If there's any fortunate part of that, that is a decrease over the last 2 years of overdose deaths. So we finally have seen a leveling off and a bending of the curve in the opposite direction for the first time in a decade. So that is great news. But when you think about it, if you don't address this issue, it's going to continue to get worse. And we know how this got created. This was started with, pharmaceutical companies really aggressively marketing opioids as non-addictive substances, doctors prescribing these substances, and then, by the time we realized it was happening, it was kind of too late. People had already gone down the path of getting addicted, and then we kind of cut people off from those substances, what ended up happening then was it sent a lot of people to the street to either buy counterfeit pills or other people's prescriptions that were unused, or even illicit substances like heroin. People who were, in business suits, working in downtown, who had some type of minor injury, are now addicted to heroin. And that process is not a long process for something like that to happen. And people oftentimes ask me, like, how did that happen to you? It happens in the snap of a fingers. You don't realize it's happening. You underestimate the power of the substances. You don't understand the neurological consequences of taking them. If you're in politics like I was, you have a false sense of security. You think you're somehow more powerful than those things, and that you've pulled yourself up by the bootstraps before, and you've moved in a forward direction. You should be able to do that again. Addiction doesn't work that way. Addiction is something that will rob anybody of all that stuff, and it doesn't really care about who you are, how much you have, what your demographics are. It's going to go after you, and that's what we've seen a lot with this epidemic. We've seen, where traditionally these drug use has been a real problem in the core of our communities, the cities. Now we've seen it spread out to the suburbs, right, as a result of this opioid crisis. So what do we need to do? There's lots of things that we're doing. Do you want to hear a little bit about some of the work of the task force?
Absolutely. Let's hear about the task force that you chair, and as you say, the numbers decreasing. Rhode Island already has a higher than... Well, it's in the upper echelon of percentage of where this epidemic is impacting the amount of people.
Yeah, we're definitely in the top 10, worst states that the crisis has hit. Governor Raimondo, when she was campaigning in 2014, that I alluded to earlier, was hearing from a lot of people about the crisis and how it was impacting individuals, families, and communities. So she knew one of the first tasks she had to do when she got into office was to start to address it. And she really believed that she could use the bully pulpit of the governor's office and the executive authority that she had received to make a change. And so she, by executive order, established the task force. She was very specific with the task force. She directed it to create a strategic plan. She wanted to see metrics. She wanted to measure what the task force was doing. She wanted to know we were making progress. And so she brought together a group of expert advisors who wrote the strategic plan. And now the task force is in implementation phase of that strategic plan. They came up with 4 critical pillars: prevention, rescue, treatment, and recovery support. And under each of those pillars have signature initiatives that the state is undertaking. We've received, thankfully, due to our great federal congressional delegation, we've received a lot of federal funding to help fund a lot of those signature initiatives, and we're moving forward with them. On the prevention side, we've seen the biggest thing we had to do was change prescribing practices. Those doctors I talked about who are overprescribing, that had to stop. We've seen a reduction of almost, I think we're either the top or the second top state in the country for reduction of prescribing of opioids, which is amazing.
That's huge.
It's really big.
Factor.
And that's a great metric, right? Yeah. And we've seen, as a result of that, that means we're putting less people out into that stream who could get impacted by this. Right. On the rescue side, there's a life-saving antidote for opioid overdose called Narcan or naloxone. We knew we had to scale that up. It had to be in the hands of anybody who was at risk, not just first responders. First responders are important, and clearly that was an initial priority to get that in the hands of first responders. But secondly, people who are impacted by this and people who are at risk for overdose need to be carrying it as well. So family members are carrying it. People who use are carrying it now. It's in community organizations, it's in places where people are most at risk. We also passed a regulation that it gets co-prescribed now with any opioid for anybody who's at risk. So you've had this really influx of naloxone. So that's helped.
That's huge. And there's just a pushback on a notion that's been floated around that I've heard a lot, this idea that you shouldn't administer it to somebody because they're going to wake up and they're going to punch you in the face. And I think that that's a dangerous mentality to take into this entire process. You know, it separates people by, how much are you willing to risk for human life, I guess.
Yeah, the governor was on WPRO. They did a huge opioid awareness day, which was great. Yeah, enough, right? Yeah. And it was 15 hours of straight programming on the crisis, and it was great. But they took calls during the program, and some of the people who were calling in they had that thought. It's like, well, you better be careful. Somebody's going to wake up. They're going to go into withdrawal. They're going to be agitated. They may even become violent. And I'm like, wait a minute. If you don't administer the naloxone, they die.
Right.
That's the hell. How could we allow that to happen? That's not something we want happening. So I'd rather somebody be agitated, even violent, as long as they don't die.
Right.
And the governor was amazing, of course, as she always is. She said, if my kid were overdosing, I would want someone to administer the naloxone regardless of what that person's going to be like. And so we know that's a challenge. We have to engage people better. We have to educate people about that and make sure that people understand. And this is part of the stigma, by the way, of this illness, right? There are a lot of negative public attitudes around people who are using drugs or even in recovery. And so we have to change those attitudes because if we don't educate people that this is a disease, that people can and do recover, that people need the help, and an overdose, by the way, can be the jarring experience that brings about a more rigorous application of a recovery program for somebody. Right. So if they overdose, that could be something that helps them. It can be a moment of clarity for them as well, and let them understand, like, you just got a second chance, buddy. I talked about the second chances I've gotten as a result of my recovery. That's that second chance people need. Yeah. So the rescue strategy is critically important. We have a treatment strategy. We know that there wasn't enough capacity to treat all the people that had been affected by the opioid crisis. Opioid use disorder is something that is treated with 3 FDA-approved medications. There's methadone, there's buprenorphine, and there's naltrexone. So we wanted to make sure that those 3 medications were available they were available on demand to anybody who wanted them, because I'm sitting in your studio here and you have a little window here, and the window's cracked just a little bit. Thank God, we're getting a little fresh air in here. Right. The same thing's true with somebody who's going through an addiction. That window cracks open. And sometimes it's just a small crack in the window. That's that window of willingness we talk about when we have the opportunity. If there's not treatment available for that person when that window's cracked open, we may lose them. They may be back out using again, because people do. They have that moment of clarity. They want to get help. And so we need to make sure help's available. So we've scaled up evidence-based treatment for those folks. We've developed centers of excellence, which make sure that we wrap around those 3 FDA-approved medications, psychosocial and recovery supports, so that the person has a better outcome when they use that medication. Because a lot of addiction is, you have to stop using the substance. However, another part of it is rebuilding your life. I talked about how I rebuilt my life. I did that through these psychosocial and recovery supports. So we need to prepare people that that's going to be part of their journey. So their treatment piece is really, really important. We've had some great success too. I just came from a rally for recovery at the women's prison. What a heartwarming event that was, where we had people who are incarcerated get up and tell their stories, talk about the hope for recovery. You're sitting in a prison yard with 150 women who are behind the walls, who have hope that recovery is possible for them. We have a medication-assisted treatment program at the prison. We're offering people all three forms of medication there at the prison, and as a result, we've seen a 61% decrease in overdose deaths from people being discharged from the ACI. So that's part of our treatment strategy
metric
too.
Right there.
It
so
is
practical.
Totally. And before they were saying, well, you're in prison, we're not going to put you on treatment, go in your cell and detox there. And what we were doing, number one, we weren't recognizing this as a disease that it is and that people need treatment to recover from it. The second thing we were doing is we were making people very susceptible to overdose because they didn't get the treatment they needed. When they left prison, when they were discharged, they went right back to using. And because their tolerance levels decreased while they were behind the walls, they overdosed, and many of them died. They had 2 quilts at the recovery rally today. The women in the women's facility made these beautiful quilts. There's a Reverend Joy led this quilt project, and these beautiful butterflies that they made. Butterflies are a sign of recovery, and it's a sign of you being reborn and spreading your wings and living your life. But these women whose names were on these butterflies are people who were lost after they were discharged from the ACI to overdose. So beautiful quilt, really sad story behind it.
Right.
But the treatment strategy is super important. And the last piece of our strategy, Bill, not to go on too long, but is our recovery strategy. Because we know that if you just invest in treatment for an individual and you don't invest in recovery support following treatment, you're throwing good money after bad. Right? If you don't wrap around those psychosocial and recovery supports around somebody, they're not going to succeed. Their chances for success are much, much less. Let me give you, an example. We know that the 3 most important things that help somebody sustain their life in recovery are a house, right, a place to live, an education, some type of educational opportunity, and a job. Right? Those are the 3 most important things. And so our recovery strategy has created recovery housing that's available to people. We will support people to get into a recovery house, help them with their rent up to a year so that they can get back on their feet. We also have educational opportunities, apprenticeship programs, and other type of educational opportunities to retrain folks who maybe have been out of the workforce for a long time and don't have the skills to get a job. And then we have another program called Recovery Through Opportunity, or Recovery Reimagined. It's our Recovery Jobs program, where right now, as we're sitting here taping this podcast, there's a cohort of students who are in recovery that are down in a job training program, and they're doing 3 weeks of job training, and they will then get placed in an employment situation where their employment will be covered for that first month so that an employer can take a chance on that person and they can get back in the workforce. So not very different from the regular from the rest of the community, right? That needs a place to live, needs an education, and needs a job. But it's really critical for somebody who's in recovery. If you want to give them their life back, you got to create purpose, and you got to help them with the social determinants of health, the things that we know that they need, like housing and transportation and a job. Really, really important.
It's a robust strategy. You know,
Yes.
I mean, there's no other way to put it.
Yeah.
And it kind of pushes back on also the idea that it's, that it's all talking points coming
Right.
from government on this issue or something like that.
No, this is a real strategy, and these are real programs I'm talking about that have been able to been developed and carried through. We have an amazing team. I co-chair the task force with Dr. Alexander Scott from the Rhode Island Department of Health. She's the director there. And Rebecca Boss, who's the director at the Department of Behavioral Health, Developmental Disabilities, and Hospitals. They have incredible staffs who are working full-time on this. And the task force itself is made up of 50 people from the community who come together on a regular basis. These are, we have people from the legislature and from other government agencies who are on the task force, but we also have first responders. We have police officers. We have, EMS professionals. We have health insurers who are on the task force. We have the hospital association that's represented there. We have family members. We have people in recovery on the task force. We have prevention experts on the task force, treatment professionals. So these are the folks who really deserve the credit. I get to go out and talk about the strategy all the time. I'm not the one who's physically implementing it in the community. Right. The person who was at the prison today, she's a person in recovery. She's a professional recovery support specialist. Phoebe Harrington is her name. Did this amazing job of putting on this rally today. If it weren't for people like that who are out there doing the programs, Dr. Jennifer Clark at the prison, who's seen the 61% decrease in overdose deaths, treatment programs like Coderre, who are one of the leaders in the Centers of Excellence program. We have the Hope Initiative at the Rhode Island State Police, who are going out. We're pairing a clinician and a recovery coach with a law enforcement professional who follow up on people after an overdose. So if you overdose and you're in the hospital and you get released, your information gets communicated to the Hope Initiative, and then they follow up with you afterwards to make sure that you kept your treatment appointments, that you that you're doing okay, that you don't need more engagement. So that's a really important thing. They're also working with the drug court, and they're working with the ACI for people who are being discharged or in those programs as well. So these are the real heroes that are out there. Captain Moynihan at the Hope Initiative, and we've got prevention task forces in Rhode Island Student Assistance Center, and we've got the Rhode Island Medical Society, who has helped us with the prescribing from doctors. There's so many people that are involved in the effort.
And other offices, state officers as well. I mean, we've heard a lot from the Attorney General's office this year on this side. Obviously, his legislative package didn't make it through, but the ideas
brought that up.
Are there.
I'm glad you brought that up. Yeah, no, the House and the Senate have been extremely supportive. They passed an opioid stewardship fund bill in the budget this year that the governor worked with them on. It was, $5 million that's coming from the opioid manufacturers and distributors and wholesalers. The AG has the opioid lawsuit against the pharmaceutical companies who created this problem in the first place. He also had a package of legislation, the felony reclassification bill, which would help people who are, receiving felonies because of their disease primarily, to receive a different level of drug crime, and make sure that, because these are the things that prevent people from getting jobs in the future, or getting housing, or even going back to school, quite frankly.
Just overall morale, too.
It's a big deal, right, for people. So the Attorney General has been super supportive. The U.S. Attorney as well. The new U.S. Attorney, Aaron Wiseman, has been great. He's been on the task force and really has been a great partner in this work. So I was down in Warwick. This September's Recovery Month, by the way. Happy Recovery Month. We have something called Rally for Recovery. It happens all over the state. There's 4 of them. The first rally was in Warwick a couple weeks ago on the Warwick Mall grounds, and the Warwick Police received an award from the Rally for Recovery Committee. And when the chief got up to accept the award, you know what he said? He said, "Guys, this is a real honor for us, but don't worry, you guys are the true heroes. You guys are amazing." And he goes, "We have your back." For people in recovery to know that law enforcement has kind of flipped the script, they've changed their whole outlook on this. They knew that a new paradigm was needed, that we couldn't arrest our way out of this crisis, that we needed to partner together and have a public health and public safety approach that really was integrated, and it's really, we're seeing the results of it.
Last 30, 45 seconds here with the recent news on vapes. How does that play into some of the work you're doing? I mean, I don't want to draw a line between vapes and serious addiction.
I understand, but this is also a public health crisis, and I think that's why the governor felt really compelled to take action this week and to direct the Rhode Island Department of Health to issue emergency regs to stop flavored vape products from being sold, because she really believes they're marketed toward children. And that's what all the evidence shows us. We've seen a 78% increase over the past couple of years in youth vaping. These are kids that are in middle school and in high school who are vaping. It's pretty dangerous. And now we've had 10 deaths now. There was a new death announced last night. 10 deaths and over 500 cases of some type of sickness or pulmonary infection as a result of vaping. The governor really felt that, to protect Rhode Island's kids, we needed to take a really strong look at this. So she's directed the Rhode Island Department of Health to issue the emergency regs. We're going to establish an advisory group of doctors and other health professionals to look at this and make sure that we're not allowing this to continue on and then all of a sudden have a Rhode Islander die from vaping. Or to have this proliferation of vaping continue with kids. It's something that they get hooked on. They get addicted to the nicotine that is in the vape product, and then they become, addicted sometimes for life. And so that's a really serious matter. So the governor felt it was important to take executive action.
Tom Coderre, Senior Advisor to Governor Raimondo, thanks so much for your time this morning.
Thanks, Bill. It's great to be with you.
That's all the time we have for today, but I'll be back on Friday with a brand new episode. And remember, follow me on Twitter, Instagram, and Facebook at Bill Bartholomew. Until next time, we'll talk soon.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.